It's important to know about the signs of male breast cancer. Many times men overlook these signs because of the notion that only women get breast cancer. So today in this video, we will be talking about male breast cancer. This is not talked about often enough, but it needs your attention. Let us learn the signs to look out for and precautions you can take to avoid this. After all, we all want to live happy, long lives. The first is understanding male breast cancer. While women are more prone to breast cancer, there is still a possibility of its occurrence in men, as this involves abnormal cell growth in the breast tissue of males. The word breast actually symbolizes not just the women alone, but the features present on the male body as well. It's just that men's breasts are not as dense as women's. Though breast cancer carries the stigma of being primarily a women-linked issue, it is still important to pay attention that men can also be affected by the disease. You know what? That is the key misconception that is always associated with breast cancer being a disease of women exclusively. On the other hand, it's not even that simple. Men also have breasts, except this time, it is negligible in comparison to women's. On the other hand, being in the family without a history of breast cancer doesn't mean you are immune from the disease. Occasionally, men may suffer from the disease, but generally with lower frequency compared to women. Now, let's talk numbers. Suffice it to say, male spontaneous mammography is even far rarer than breast cancer in women, but this won't stop it from occurring at all. According to Opinion, one man for every breast cancer case is being estimated. Although the chances are less, all the same, let's not be too careless around this and keep a watchful eye for these warning signs or symptoms. Types of male breast cancer. Now, there are a few different types of male breast cancer to know about. Ductal carcinoma. This type is the most popularly known. Initially, we have nipples that act as a doorway, and it goes to the porous vessel that helps to supply nourishment. Ducts or tubes are where cancers start, and it's called ductal carcinoma when it occurs inside the duct. Lobular carcinoma. This one happens to be not so frequently known. It starts in the lobules of the milk gland, the glandular part of the breast. So when the focus is on these glands, then cancer appearing in them is called lobular carcinoma. Other types. In addition to the several other beloved ones, for instance, Paget's disease of the nipple and inflammatory breast cancer. They're not so typical, but they still should be remembered by you. Causes and risk factors. Okay, now let us examine, with some detail, the factors that can double the risk of male breast cancer. While we don't have all the answers yet, there are some things we know might play a role. Your age. More than any other factor, it is aged people. The elderly men are more likely to develop male breast cancer, generally at the age of 60. That does not imply that younger guys are exempted after all. It's just rarer in them. Hormonal influences. Now, hormones come into play. If you have been on hormone therapy for prostate cancer or have taken drugs that have the same effect as estrogen, then your risk of breast cancer may be slightly increased. Sometimes our hormones could be like a double-edged weapon. Genetic factors. This is when things become a bit more tricky. Sometimes everything depends on the genes. To start with, some DNA changes, such as in the BRCA1 and BRCA2 genes, can make it more probable to a person. It's sort of like having a genetic code that, in a way, determines how you play the game of cancer. Medical conditions. Next, there are those specific health conditions that can move the risk meter above the elevated range. For example, look at men who have Klinefelter syndrome. It's a genetic phenomenon when a man is conceived carrying an extra X chromosome. Also, liver diseases can cause hormones to be out of balance, which likely increases the risk. So even though there is not always one very simple reason, it's often a blend of factors that get involved in the risk of having cancer. It is just like a puzzle, and the tiny pieces like age, hormones, genetics, and physical conditions all fall into place to form a complete picture of the risk. However, being aware of the components of a stroke can help keep us on our toes and take steps to reduce the chances. Has this video been informative so far? If so, please do not hesitate to share it with your friends, family, and loved ones. Everyone needs a bit of information from time to time. Let them also learn about this issue and be safe. You can also like this video to show me your support. And do not worry, I will be talking about the signs and precautions too. So stick to the end of the video for everything you need to know about male breast cancer. Recognizing symptoms. If a man is able to recognize the early symptoms of male breast cancer, it can make a huge difference in the treatment. Let's talk about what signs to watch out for so you can stay on top of your health. Painless lump or thickening. Among the key indications you should be observant of is a lump or hardening of tissue in your chest area. you may not feel bad, thus it becomes hard to notice. In this case, a good way to do it is to do chest self-exams frequently by gently feeling for any odd bumps or changes. Changes in skin texture, it is a good idea to pay attention to your skin too. If you experience any dimpling, puckering, or scaling on your chest, it could be a sign that there's something going on below the surface. This might be like the skin stretching or looking like wrinkles, but in a way that looks different from before. Altered nipple appearance. Your nipples can be a small but informative sign of your breast health. Watch for any unusual changes in their appearance like inversion or discharge. For example, if you notice the nipple turning inward or fluid coming out of the region. It is because of these changes that it is altogether important to seek a doctor's opinion about any unusual observation. When to seek medical attention. While they are the main symptoms to be aware of, it is important to keep in mind that everyone's body is unique, and not every guy with male breast cancer will have the same signs. Others, too, might experience other symptoms like swelling, redness, or pain around the breasts. If you see any signs that you bother or that can be dangerous, it's a good idea to save yourself by following the advice of your healthcare professional. Therefore, consult him or her and describe all symptoms you have before making any assumptions. In case there are any concerns or a suspicion, do take your doctor. They'll be with you throughout this entire process and can sort you out with the appropriate direction for the next stage. Just make sure that the early detection of the disease is observed because it is very crucial, which implies that you should be aware of any changes in your body, and you should seek medical attention as soon as possible, which can greatly facilitate the process of diagnosis and treatment of male breast cancer. Prevention strategies. Let us discuss some significant strategies that may be employed to prevent breast cancer among men. While we will not be able to entirely nullify it, we tend to not forget the ways to lessen the risk. Shall we dive right into it? Genetic screening. Genetic counseling and testing should be considered first, especially if it is worried that there is breast cancer in a family history, as well as if there is a known mutation of particular genes. This may provide you with a better understanding of your risk level and inform appropriate protection measures you may need to take. Regular monitoring. This other critical thing is self-examination turned out to be very important by observing your breast health. Yes, that implies doing a quick check every few days in order to look for any lumps or anomalies in the tissue found in one's breasts. Also, do not ignore any symptoms that seem surprising to you if they occur. Feel free to contact your doctor for just that. Transgender health. Now, if you are a transgender looking for screening to confront breast cancer further, you should approach your healthcare provider to have these discussions open. Through this discussion, you can learn more about your risks and what screening options are available to you so that you can make sure you are receiving the care you need. Through the implementation of these preventive tactics, you will have the opportunity to be more active and alert about breast cancer prevention, which is crucial for the defense of your breast health. And above all else, keep in mind that your healthcare team is with you, guiding you through this whole thing too. Male breast cancer may not be common, but it is important to notice it in the early stages. After all, this is a dangerous disease no one wants to go through. Look out for the signs and take the necessary precautions. Raise awareness and stay healthy. I hope this video has been insightful to all of you. This is an issue you must not overlook. It is important to look after your health and take the right steps. So if this video has helped you, you can share it with your friends, family, and loved ones. You can also like and subscribe to more videos on health. Always remember to take care of yourself and let others also learn about new things. Until next time, folks.